about the Swiss protocol and the protocols I used on my hometown of Guernsey, my home island. So this is basically Lake Geneva, and the mountains you can see are the Evin Mountains. This is actually France looking across the lake. Okay, the Swiss protocol is a long way behind us. Okay, it was invented by somebody, but we adapted it and went for it. And by the time we adapted it so much, it was nothing like the Swiss protocol. So we just use it as a guideline. But when I left Switzerland, it was improved. So we'll start off with the basics. This is our little chateau. Okay, we actually did a lot of cooking and preparing food and growing food with them. We also went for lots of treatments, but unfortunately at the time we only did stage 3 and 4 carcinomas. Autism was treated, but not as many as I did when I got back home to Guernsey. Okay, we also did Parkinson's, Alzheimer's and multiple sclerosis. Right, so when we was in Switzerland, the Golek was injected into the proximity of either the inguinal or axillary lymph nodes. The nodes were chosen depending where the disease was. So if it was like a liver or prostate, it was done in the inguinal lymph nodes. And if it was a breast cancer or a glioblastoma or an upper respiratory thing, it was done in the axillary lymph nodes. We used nebulization. The lungs are really large organs and they have loads and loads of macrophages there. The actual size of the lungs is about 3 tennis fields. So the nebulizer I used was an Omron A3. And the reason I chose that because it actually allows you to choose the particle size. So if you have a lung cancer, you can choose the particle size to get the maximum delivery. Suppositories, you try to get them ordered in French when you don't speak French. They were used to target the hepatoportal system. So that was useful for prostate cancer, and we also use it for the liver. The probiotic yogurt I fermented down in the clinic. It had lactobacillus strains in it, which I like to use especially for autism. And it was given to restore the gut microbiome. Okay. Ultrasound was used to measure tumour mass and to demonstrate tumour system activation via the increase in splenic blood flow that I discussed yesterday. So Monday, the patient would come to the treatment room, we would look at the tumours, measure them, and then we would demonstrate the splenic blood flow. This way they had a visual thing to actually see what they was doing. Right, this is the Omron A3 nebulizer, and it's worthwhile buying. It's not expensive, it's about £80 English money. And this other little one is actually by the same company, and this is a little tiny handheld one, which is good when you're chasing autistic children around your clinic. And it's very quiet, and you can actually just sit with them, or if they won't be compliant, you can actually move around with it. Okay. Also as well, we used ultrasound. And the one on the right is actually the one that we use. That's the expensive one that is for use for medical diagnostics. We also, because of the nature of the autistic children, we could not risk a big expensive machine to be used. So we actually purchased a veterinary ultrasound, which could just tell if your cat's pregnant or something, but it's a low frequency and it's got a convex probe, so it would actually open up to the blood-brain barrier. And it has to be a convex probe, and it has to be 10 hertz or less to do that. Okay, so at the clinic we did weight loss, weight measurements 3 times a week, especially when you've got stage 4 terminal carcinomas that you're trying to reverse. They do lose weight, so you have to be very, very careful to measure the BMI, visceral fat and things. We did hydration status. We made sure that they were fully hydrated. Most patients when they come are subclinical dehydrated. We did juicing with papaya and pineapple because of the enzymes that they have that actually help to break the biofilms. We could not do intravenous vitamin C, but we found liposomal vitamin C was the best deal that we could have. We also did a lot of teas, which are known anti-inflammatory factors. We also did vitamin D3, some omega-3, and they put on low-dose aspirin as well. What we also did, and Amar covered this nicely yesterday, we needed to provide them with essential amino acids to actually do cellular rebuild. And we chose at the time the ketogenic diet for our clients. And also as well, we asked them to exercise. Now this little man here is Freddie Mercury, statue of him, looking over Lake Geneva. Okay, the motto and mission statement for our clinic was failure is not an option. We did not want to fail any of our patients. We want them to get better, we want them to recover, and we give them the treatment protocol that they could do at home, and I would call them up to make sure they was actually complying. The Swiss clinic was very successful. The tumour reduction was average 25% per week, but I really wanted 40% if I could get it. And 75% of them from the clinic recovered if they continued to follow the protocol. So what were we missing though? Why weren't we able to help the other 25%? What did we do? So I thought I'll get bored. I had a lot of time in Switzerland because I didn't speak French. So I went on to PubMed and began to have a look to develop, to see what was missing. Okay, what I did find, and this was found at an airport in a magazine I picked up, was symptoms of magnesium deficiency. It doesn't come out very well on here, but what it did show me was in the life-threatening challenge, you've got Alzheimer's, Parkinson's, carcinoma. So I then realised that most of the patients were magnesium deficient. And I spoke to a naturopathic doctor, and they said that if you treat magnesium deficiency, it could take up to a year to recover. And it's present in most of the population due to modern farming methods. It's a catalyst in most chemical reactions. It helps to produce and transport energy. It helps in protein synthesis. It's also responsible for nerve transmission and nerve signaling, and it also helps muscles to relax. It's got loads and loads more actions, but I don't want to discuss them at the moment because it would take up about 2 hours really. So, okay, as you can see from the diagram, magnesium is needed this is on the vitamin D axis, which we're interested in. We are vitamin D binding protein, so I looked at how many magnesium molecules were actually needed to actually produce and transport vitamin D, and it was a lot. Okay, so the patients on high dose vitamin D3 would need to supplement with magnesium. And also as well, we try to get them to not have sugar. Yeah, we say no sugar, or if you do, use low glycemic index foods. So for every molecule of sugar you consume, it takes 54 molecules of magnesium to clear it out. So that's an awful lot of magnesium. Okay, the reformed cancer protocol, which is now technically was the Guernsey protocol, but we move it around as and when we need it. Monday to Friday, they were nebulized with GoLeg. I'm talking about the advanced stage 4 terminal cancers that we come to. The injection was given to the appropriate lymph nodes into the proximity. You can Google them, find out where they are. We were fortunate enough we could actually use the ultrasound to show our clients where their lymph nodes were. And then they went away little crosses or little circles just for the first week or so. Okay, the suppositories were given containing GoLeg, but Dr. Vogler now has got another way of actually delivering the GoLeg, which we are going to be investigating. And we gave them ultrasound if required. We targeted the tumour and we targeted the spleen so they could see what was happening. Every day they were given a yoghurt containing GcMAF and an appropriate oil. Now, in England we can't use any oils containing cannabis. We could in Switzerland, so for the autistic children we added hemp oil. That's what we could do on our island. They were given MAPs, which are master amino acid patterns, and they are the essential amino acids which are needed for cell repair. Which AMAR makes as well. But, okay, so you need to speak to AMAR. We put our guys on vitamin D3 of 10,000 because we thought that was a safe enough thing, but we did encourage them to have blood tests to find out how deficient they were. We also, for protection, we put them on K2. And I always like to have them on a B complex containing methylcobalamin. The magnesium was oral and or transdermal. If I had time, I would actually do an appropriate massage with them or see if they could go into a bath containing Epsom salts. all of my guys, because I wanted the cancer to be exposed, Amar said yesterday about the D-dimer, some cancers can surround themselves with fibrin. If you use these enzymes, which again are available in the super enzymes, they will actually try to get hold of the biofilm. And again, high dose vitamin C, but we could only use liposomal. The breast cancer, we could obviously measure that, it's an external organ, so we could actually look at the tumours in the breast cancer. But also, we noticed with our ladies that a lot of them had thyroid nodules. So we could look at the thyroid to see if there were any nodules. If there was multiple nodules, we were safe, we knew it was just a thyroid problem. If we found just one nodule, then we had to get them to have a biopsy to check that it wasn't a carcinoma. If you've got multiple, you're safe. If you've got one, there could be other things. We also checked for iodine deficiency, so we got them to put iodine on their arm to see how quickly it got absorbed. The pancreatic cancer, I put them on pancreatic enzymes as well as the protocol, and also nigella seeds were added because of their documented help with pancreatic cancer. The PINI score was a big problem because when they came to me, their PINI scores should be less than 1. I was told not to do anybody over a PINI score of 30, and when they came to me, I had values of 75, 86, I even had one of 91. Now this is gone beyond, this is life-threatening. And when I spoke to my doctors about it, they go, Lynn, why did you take them? Well, basically these guys have been given 2 weeks to live. And that's not fair. They've got the right to have appropriate care or to try and change it around. The Goliath is a powerful tool, and I just couldn't say to them, I can't help you, when they'd been given that bad news by their oncologist. And bad news isn't good, it's detrimental. Okay, a lot of the guys were dehydrated. They just would have a couple of cups of tea per day. And I said to them, well, you know, you need to actually think about structured water. This is water with salt added to it. And to drink at least 2 litres of it. And this was horrifying for a lot of them. They could drink pints of beer, but they couldn't drink water. Other things that we discussed was to do juicing and to do an organic free diet, you know. And also as well, what people don't realise is there's EMF in the environment from mobile phones. If you go to sleep at about 10 o'clock, and you can sleep, if you're lucky, you can allow melatonin production and the opening of the blood-brain barrier. During REM sleep, the blood-brain barrier opens transiently for the clean out of the brain. Okay. We also discussed exercise and hypothermia. I used a Rife machine carefully, and I also encouraged them to go to a couple of friends of mine for lymphatic drainage. And the superfoods that we had were lemon, ginger, turmeric, coconut oil and hemp oil. But with turmeric, you have to be a little bit careful with that, because if they're on blood-thinning drugs, it can mess that up. Okay, so basically, we needed extra tools in our toolbox, and this is Angelina Jolie to do that. The human body is not designed to attack itself. It just doesn't want to do that. Why should it? It wants to live to 250 years old if it can. We used to live a lot longer. One of the ones I kept on seeing when I was looking at the pathology reports was the Epstein Barr virus kept on coming up. And it has created a secret epidemic. It's just a really nasty bit of work. There are 60 known viruses, and some are aggressive. There are many ways to catch the virus, and it has 4 stages. The first one, it's dormant. The second one, it's infective, and this is where you get the glandular fever, the kissing disease. By stage 3, it's decided it wants to go and infect an organ. It usually targets the liver first, and then when it gets fed up with being in the liver, it'll go out to do the thyroid. Blood tests will detect antibodies, but it will detect a past infection, not the current viral activity. The viruses also excrete toxic waste. Some of these products are neurotoxins. These confuse the immune system, and the virus is safe, and stress hormones lower the immune system, and then the virus has the ability to migrate and to progress and attack the nerves, causing pain and inflammation. GcMAF and Goliath are very successful molecules with many actions. David discussed this with you yesterday and sometimes today. They are both of these are immune system regulators. amongst many of their actions, they can either upregulate or downregulate the immune system as required. They also activate macrophages, which can then search and destroy the pathogens. I've used GcMAF and Golaic to treat many cancers, but my main one is Golaic that I like. And I'll just describe 8 diseases. David said it does 50, but these are the 8 that I love. I like them, but the patients don't like them. And the treatments that I use for them. Okay, chronic fatigue. This isn't a good one. They just can't get there. They just can't get out of bed. It's not fair, like that lady that spent 3 years in bed. You know, they just can't do it. It affects more women than men. That I don't know why. But what is interesting about these guys is they don't have fingerprints, or they have partial prints. So we gave this information to Scotland Yard, and that kind of made them think, oh, okay, so they had to rethink all of their things. And there is a thing called the Bell scale, which you can use to measure their improvement. I start them with small doses once every 5 days, because what I don't want is a cytokine storm or a Herx reaction. So we gently allow the immune system to respond, and then as it responds, we put them onto higher doses. Diet and a biofilm removing treatment has shown to complement the action of Golaic. Fibromyalgia, okay, this is one. There are ways to identify it using blood tests. Again, with the fibromyalgia, you want to start them off low, but I give them 0.25 every 5 days. The patients we worked with were usually in a very stressed state, and this has been talked about with emotions and everything. So we explained that the stress hormones can suppress the immune system, and we encouraged them to do lifestyle and dietary changes, because a lot of them were on the typical Western or typical American diet, which wasn't very good for them. Right, multiple sclerosis is a bit of a different one. The multiple sclerosis, by the time I got them, they were actually wheelchair bound. So again, I gave them 0.25 Golaic every 5 days. And then when they did it themselves, they gave it at bedtime. The reason for that was the blood-brain barrier opening. They were nebulized, and we also did ultrasonography to open up the blood-brain barrier. We also asked them to think about coconut oil as a fuel for the brain. I asked them for dietary changes, and then we could actually get positive results if we asked them to do the ketogenic diet. But also as well with these guys, because they were wheelchair bound, I used one of these devices. It's from Russia with love, a scanner machine. You can have a look at it later and I'll show you. And what I was trying to do with them is to restore the lymphatic passage, which was blocked round about in the carotid artery. Right, hypothyroid. This is one close to my heart because I suffer from it myself. It's not easy detected using routine tests. You know, you'll get, in England, I don't know what you do over here, but you'll get T4 and TSH if you're lucky. Then if the laboratory technician loves you, you might get a T3 if you're lucky, but that's about it. Whereas you really need reverse T3 and a few other, sorry, I'm getting nervous here, and a few other blood tests that will actually help. Body temperature is usually a good indicator, and if they run about 36 like me, that usually means that the thyroid is underactive. But what we can do, and even I can do it now just about, is we can demonstrate multiple thyroid nodules via the ultrasonography. You just put it on your thyroid, you go, oh, there's one, and it's quite easy to do. Also as well, Epstein Barr virus might be present. I've tested positive for it, and the thyroid is one of the target organs during stage 3 of the lifestyle. And also, with hypothyroid, we would think about iodine deficiency. Golaic was given at 0.25 once every 5 days. Biofilm enzymes were used, and foods rich in iodine were added to the alkaline diet. Now, this is my favourite. I love autism. This is my little baby. They're just like autistic kids, and they're great. They're great fun. It's a very complex disease, as we did from Dr. Kem's presentation. 1 in 50 children are now autistic, but what we have found is we can use ultrasonography to diagnose autism. If you look at these circles here, there's actually lesions there, and they are diagnostic of autism. Okay, once you start treating the autism, the actual lesions start to go. So you can see, you can diagnose it, and you can see the response to the treatment. Okay, Right, basically these slides show that the top left is actually just neurons without anything happening to them. They just came straight out of the bottle from the laboratory and just sat there. But when we treated them with GcMAF, Golaic, you can see that the cytoplasm started to change, they're becoming active. Now, Dr. Smith yesterday kindly did a beautiful presentation on the cell work, and the bottom left is actually the microglial cells and the neurons working, and this one here, they're actually talking to each other. So we actually created a brain in our little dish in the laboratory. So we were so chuffed with that because they wanted to hang out together. Okay, the children with autism, as we found out, have a malfunctioning gut microbiome. The guts can be reprogrammed using appropriate probiotic yogurt, which contains GcMAF. What they're saying is if you can get this gut microbiome working, then you will restore the neurotransmitters in the gut. Okay. And this is a really good book which describes the disease, what it does, and like that. Okay, so irritable bowel syndrome, for me, that was quite a nice one. Could get rid of it in about 2 weeks if they complied. And that was Golaic every 5 days and a probiotic yogurt. Okay, well, thank you for your time.